This is the second part of a conversation with my friend and colleague, Harvard pediatrician and professor of public health at Harvard Medical School, Dr. Michael Rich. In this conversation, we wanted to talk about what I should do. And we've heard a lot about social distancing and flattening the curve. So Michael, why are we supposed to be socially distancing?
This virus is spread by respiratory droplets. Respiratory droplets can be expelled up to 6 feet or 2 meters from the person who is spreading that. And so the important thing is to stay physically distant from that, everyone really, by that 6 feet or 2 meters. And it's important to do it not just with people who are coughing or have a fever, but with everyone, because we also now believe that it is asymptomatic people who don't even know that they have the virus, who are spreading it. And there's new information coming out all the time, including the fact that we now know from an NIH study that this virus can live on surfaces for longer periods of time than most. For example, it can stay on plastic or metal for 2 to 3 days. So not only do we need to stay 6 feet or more away from people, but we need to not touch surfaces like elevator buttons or doorknobs that have not been cleaned and disinfected. Now, a lot of people feel, oh, well, that's for other people. That's for people who are vulnerable. I'm not vulnerable. We are strong, pioneering spirit people, and we believe that we can withstand anything and can prevail. But here's the reality. We may well be able to prevail, but we're protecting Granny and Grandpa here, ours or someone else's.
I think that's really important when you talk about things are changing all the time. Whether it's the NIH or the National Institutes of Health study you referenced about surfaces, which also the Center for Disease Control talked about, or whether it's just ongoing medications. What we're finding in Alberta is our Alberta Health Services has a website, which is alberta.ca/COVID-19, that gives updated information and is really helpful with providing resources on if you're going to get those essentials like grocery shopping, or if you're riding an elevator, or if you're in public transportation, what should you think about in terms of socially distancing? So that brings me to the second question, Michael. While we're social distancing, how do we combat loneliness?
Well, this is a real issue. And actually, this brings up the fact that I really don't like the term social distancing, because what we're really talking about is physical distancing, either by the 6 feet between people or by wearing gloves or disinfecting surfaces we might touch. It's about being physically distant enough that that virus cannot reach us. I prefer the concept of physically distancing. In other words, because that's what we're really talking about, is physical distance from each other, but at the same time, socially connecting. This is a time of high stress and high anxiety for a lot of people. And one of the things that makes anxiety 1,000 times worse is loneliness, is feeling that we are alone with this, that no one's got our back, no one's going to help us. And so I think we need to make extra efforts, even more than usual, to reach out in physically safe ways to Granny, to Grandpa, to family members, to friends, making sure they're okay. This is all about the helpers, again, that we talked about in the first section, which is that we can all be helpers by preserving not only physical health, but mental health by reaching out in this way. So, for example, some of the things you can do is schedule time for your kids to FaceTime or Skype with their friends, to have social interaction online, to do things together like cooking dinner with Granny or Grandpa at a distance on the computer. And I bet you have some good ideas too.
Yeah, I think when it comes to even things like cooking, you can actually just eat together. If people like grandparents or family friends are alone, make sure that we actually are alone together in ways that we can really work on that social companionship virtually. One of the things that's happening in Alberta are young children are coloring and putting things in windows. And as people are outside, physically distancing, as you say, they're walking by and looking at those coloring projects or projects within the windows of the homes. And that's bringing people together. Even reading a book online together, and trying to create these book clubs for children and youth, or gathering with these regular meetups with grannies and grandpas and babies and brothers and sisters and aunts and uncles, and playing games in virtual community online together. These are things that will really help, I think, combat loneliness.
Yeah, I think it's ironic that I have often said no screens at the dinner table. And those are under ordinary times. You don't want to have screens at the dinner table distracting you from the people you love with whom you're breaking bread. But in this case, we're having to have screens in order to be with the people you love. And I think that, that rule, I think we can suspend until we're past this crisis. There are a lot of wonderful ways and creative ways we can do things together. There's a group called Playing for Change that has connected musicians around the world into a single song using technology. And maybe we can play together on screen. Maybe we can get online and have string quartets play, or a jazz group play, or kids just mess around. I think that one of the interesting things you said about playing games together is that many of my patients who play games like Fortnite or, Call of Duty, which in many ways I have real concerns about, don't talk about the game so much as they call it hanging out with their friends. It's a way to be together. And so I think that while I would still prefer they play more pro-social games, I think we have to understand that this is one of the ways that they play together, like they used to sit around and play ice hockey or shoot hoops together, or just mess around in the woods.
Well, and again, it's extraordinary times. And if we're to come together, we need to think of extraordinary things to do to come together to combat that loneliness. So I really appreciate that. Now, this idea of flattening the curve has really taken over a lot of conversation in the media. Can you just explain to us what it means to flatten the curve?
Yeah, the curve we're talking about here is the rate of new infections. And so what we were talking about, physically distancing and being careful of touching surfaces, this is the end result of this, is we are protecting ourselves from becoming infected or becoming asymptomatic carriers and spreaders of that infection, not just to protect Granny and Grandpa, but so that we don't add to the burden on the health care system. In other words, if we have this rapid increase of infections, a certain percentage of them are going to need healthcare. A certain smaller percent of them will need to use an ICU or need the services of an intensive care unit. And an even smaller percentage of those may end up using a ventilator. Now, that's fine and well, except if this happens so quickly that all of our ICU beds and all of our ventilators are used, then we are not only at risk of people dying unnecessarily from COVID-19, but people dying unnecessarily from manageable issues like a motor vehicle collision or a surgery that needed to be, and they needed to be on a ventilator afterwards. So the flattening of the curve is to not to completely avoid all new infections, but to slow the rate to the point where the healthcare system doesn't become oversaturated and unable to care for the rest of us.
Thank you, Michael. The first part of this was how might I talk to our children and youth about COVID-19? This part around what should I do, thinking about physically distancing, thinking about flattening the curve to really help the helpers, make sure that our public health systems have all the opportunity to treat and manage this pandemic. And in the third part of our conversation, we're going to talk about how we'll get through this. It's not a snow day. It's not a COVID blizzard. This is actually more like a winter. And how will we really get through this time? So thank you.
Thank you.